Today we are diving into the final segment of Dr. K and 20 depressed patients. I appreciate you all sticking with me through this video. There's been a lot to learn about mental health, psychiatry, the practice of therapy, and Dr. K's own approach when it comes to depressed patients, particularly ones who struggle with treatment-resistant depression. And today we're going to finish it out by watching this together. Please do like and subscribe. We are on the road to 20,000 subscribers, so if you're watching and you've stuck through all of these previous videos, please do hit the subscribe button. I would love to do a giveaway or something special for you all once we hit that milestone. So please hit the subscribe button. Let's get right into the video.
My final surrounded claim is that if therapy didn't work for you before, it doesn't mean that nothing will. Nice to meet you, Alex.
So I'm curious to know what made you choose this particular claim to bring to this.
So I think that somewhere along the way, we started saying that there's a right way to deal with depression. We said, go to a psychiatrist, take a medication, go see a therapist. And there are a lot of people who are struggling, and we said, this is the answer, this will help, this will fix you. And my experience has been that that isn't always the case.
We've touched on this in previous videos as well. There's research to say that most people will benefit from a combination of the medication plus therapy, but that does not mean that's always the case. As we talked about before, there's peer support, there's behavioral activation, doing wellness activities, such as spending more time outside, sunlight when it comes to seasonal affective disorder, movement, being in community, all of these things can be helpful when it comes to depression as well. So it's not just the combination of psychiatry plus therapy. And please don't ever believe any therapist that says you have to see them in order to get better, because that is not always the case.
And there's a ton of new research, the wildest of which, weirdest trial I've seen to date is for a stool transplant, which is what it sounds like. We take stool from one human being and then we transplant that stool into another human being. And it turns out, it turns out that this has been shown to improve depression.
Let me think about that. First of all, I do not know the mechanism for how that works. This speaks more to some of the brain and gut connection that has been showing up more in research recently, where the gut biome, the bacteria that you have in your gut, might actually have an impact on your mood, your mental health, and your overall functioning. I guess theoretically it makes sense that if your gut biome has a direct impact on your mental health, then if you were able to transplant healthier gut bacteria into your body and then those start to colonize, that you would also feel better as a result. I don't know how they got people to sign up for that research, because once you described it to someone, I'm sure they would be out. But I guess they got the research done and that was the finding that they had.
Because the bacteria in your gut produce tryptophan, and tryptophan is a serotonin precursor. And when we boost serotonin transmission in the brain, it sometimes helps people with depression. For far too long, I think we've assumed that depression is a mental illness, whereas I think there's a lot of physiology to it. And so I think there's still a lot of options out there.
Yeah, I mean, I know there's only so much that psychiatrists or psychologists can do when you're in therapy. They only have an hour to diagnose, quickly treat, or figure out something, a quick solution for them in and out, especially like in America for healthcare and stuff like that. But what kind of protocols do you think would help other people who are struggling that maybe aren't seen, or like instead of just, oh, here's a medication, try this? And
yeah, so she touches on a really good point. The way that our healthcare in America is set up is that you really have to carve out a niche for yourself if you're going to do the non-traditional therapies. So in terms of what I do, I have to abide by what the insurance companies will reimburse for, the diagnoses that they will reimburse for, and work within that system, which is rather limited, in order to provide benefit for my clients as well as get paid in the process. Now, there are other promising treatments. There are other research-backed treatments. One that comes to mind specifically is neurofeedback. Then this is not for depression per se, but this is for ADHD particularly. And neurofeedback has been shown to be really helpful for people, but it is not reimbursed by insurance. And so our neurofeedback practitioners, their clients for that have to pay out of pocket, and that gets expensive. So she's touching on a dynamic here that like there are promising therapies, there are other options, but it's not as easy to get paid for providing those options. And so sometimes people get stuck, practitioners and clients alike get stuck with the same old remedies that they've tried over and over again, because that's what insurance will reimburse for.
see what happens. And what are the like traits that you would say, oh, this person would need something else?
So one thing that's really interesting is there's evidence of inflammation in the brain with depression. As your inflammation level goes down, there is a good chance that depression improves. There are studies that, one study from 2003 found that exercise was just as effective as therapy in treating depression. I think there's a new wave of evidence-based psychotherapies, what we call the third wave. These are basically like the Eastern things. So mindfulness, a big thing that I think people can learn how to do, this is a skill, is to be cognitively flexible. So oftentimes in depression, our mind thinks one way, and then we think to ourselves, that's the way that it thinks. Learning to
CBT
think,
therapy.
not necessarily CBT, but CBT is a portion of this.
And we talked about ACT and some of the Eastern principles that he's talked about, some of the Eastern philosophies that now therapies are starting to incorporate. The goal in ACT is psychological flexibility. And that's exactly what he's talking about. People with disorders, or people in general, tend to have a more fixed way of thinking. And this solidifies more and more as we age. I think the way that I think, and it's always going to be that way, if we can develop a flexibility of being able to say, this is what's going on in the moment, this is what's going on with me, can I change the way I'm seeing this? Can I change my relationship with my emotions? That allows me to be a lot more flexible with my thoughts and my feelings. And then things like depression, things like anxiety don't stick the way that they normally would. So yes, there's a lot more holistic approach within therapy now with the mindfulness work, with the body-based work, things that are integrating body and mind instead of just saying this is purely in your head. There are physiological markers, like he talked about, the inflammation in the brain. And so there might be different ways to approach that, different ways to treat that. And that opens up the space for people who struggle with treatment-resistant depression, who have tried the same thing, probably CBT, because that's been the gold standard for so long. They've tried CBT over and over again, and maybe now there are new options that are being more recognized within the research for them to get treatment and hopefully improve.
Literally holding contrary views at the same time. So even though if I break up with someone, I may think to myself, I'll be alone for the rest of my life, and this was a terrible waste of my time. At the same time, it can also be true that one relationship gives you more experience to be successful at the other one. So holding contrary claims is another really big thing.
So that's one thing that CBT kind of hints at, but doesn't really get at. CBT tends to be stereotyped more into this is the right way to think, or I'm thinking wrong and therefore I need to fix it. What we get with things like acceptance and commitment therapy is more being able to hold the paradoxes of life, where yes, breaking up is painful, it's sad. Can I also look forward to the lessons that this gives me for my future relationships? Can I learn from this experience? Is it healthy for me not to be with this person in the long term, even though I'm feeling the hurt now? And that's where values can be very important. And so I know what I'm looking for in a future relationship. This is not a perspective that I can prescribe on my clients, because then it sounds like I'm just giving them the silver lining. Oh yeah, I know it hurts now, but don't worry, this will be better for you in the long term. Like, that person wasn't good for you. It's both validating how I feel right now, as well as being able to hold the hope for the future. So we're not so focused on the pain that I'm feeling right now, but also like, maybe this is a necessary move for me to make based on what is important to me.
Dietary changes. We know that certain kinds of gut bacteria will actually improve depression. I think there's a lot out there that can be really helpful.
A lot of the therapies that people go through are the talk therapy and the medication therapy. I've been on SSRIs for a very long time. I recently stopped taking them for the past maybe 5 years, and I found that it really didn't help. But the other forms of therapy I've tried, they help, but I always get back into the loop. Then I go through 2 weeks of, oh man, I don't enjoy this anymore. I get the anhedonia, or the lack of motivation to do the things that I used to like, or I'm not getting the same oomph from what I was doing. What are the treatments after that? What am I supposed to do?
Anhedonia is a really tricky one. Along with losing your sense of enjoyment, a lot of motivation goes. Like, if everything feels kind of bland and gray and not interesting to pursue, it becomes really hard to work outside of the therapy space. Oh, I guess I should go work out, or I should choose to eat healthy and prepare this meal. It becomes really hard to start those habits that long term could be helpful for us, but that's where behavioral activation can be difficult. When you start losing the enjoyment in life, when you start losing the motivation. As to what she was saying about the food piece, that is something that I would love to pursue. Maybe get some kind of certification in nutrition or something, because I hear some of the things that my clients talk about eating, and I so badly want to be able to dive into that with them, but I don't have the knowledge or the certification to really be able to say with any kind of expertise. I just know that it's not good. Eating a lot of processed foods, a lot of sugar, a lot of junk just in general. And so maybe that would be a good leg to stand on, and maybe a holistic approach to be able to helping my clients, just to say, hey, let's examine the foods you're eating and what effect that might be having on your brain, whether it's brain fog or low motivation and low energy, might not really be setting you up for success when it comes to your mood long term.
Yeah, so I think, what I'm hearing is, and this is unfortunate, sometimes you can do everything right and you can still feel like shit. And there, somewhere along the way, we got this idea that if I do more right stuff, it'll fix it. And I think the thing that scares me the most as a psychiatrist is that it doesn't always work. It hurts that people have to try so hard to just not drown.
That's one of the paradoxes that we need to be comfortable with, or at least to be able to acknowledge. We do have this mindset, I think particularly in America, where it's like, if I do enough right steps, then I deserve a certain outcome. And what that means is that when things are not working, that means that I'm not doing enough. I am not working hard enough. I'm not doing the right things. I'm not pursuing the right treatments. And it could very well be that I'm doing all the right things and I'm working hard enough at it, and my body's just not responding the way that I would like it to. And so that does require a lot of awareness, a lot of psychological flexibility to be able to say, man, this sucks. Can I let go of the expectation that my body should be responding the way that I want it to because I am doing X, Y, and Z correctly? And sometimes it's that expectation that is adding the additional stress, that is keeping me feeling depressed because I'm not feeling better the way that I think that I should be. And so that does require a lot of mindful awareness just to kind of monitor where I'm at, what is my relationship with the way that I feel right now, and can I accept how I feel without judging it? I appreciate that he's emphasizing throughout. These are skills to be acquired. It is not just a change of mindset that happens one time, but it's something that we are constantly calibrating, constantly monitoring, and eventually it becomes easier, but it is something that we do have to work at.
And I wish I had an answer that there was some way to make everything better. I think that's the real struggle. There's something really weird that I've seen happen, and I wish I knew how to make it happen, which is sort of accepting that, you know what, this is something I'm going to have to deal with for the rest of my life. That once you sort of accept that, there's sort of a burden that can be eased up on. And then once there's a little bit of that easing of the burden, things feel a little bit easier. The weight becomes easier to carry. And I don't think it fixes everything, but I've seen some people really do get way better. And then everything else starts to work a little bit more. But I think there is that fundamental, grappling with the unfairness of being born with the curse of depression.
He makes a good point. This is, again, part of acceptance and commitment therapy. ACT is not going to fix the problem per se, but it's going to change your relationship with the problem. A lot of the resistance that we have is this medication or this therapy is not providing me the amount of benefit that I feel like I deserve based on the work that I'm putting in for it. And then to be able to accept that maybe this is the way life is going to be, maybe this is the way that my mind works, allows me to approach the daily struggles of that with a bit more resilience, with a bit more openness, just to approach it with, this is the way that things are right now. I don't have to love it. I would love it if things were different. And I think he's acknowledging that there is a struggle of, can I accept that there is unfairness in my life? But what he's saying is when we take the pressure off of ourselves to find that magic bullet, to find the fix for it, then it becomes easier to live and coexist with that, even as we're still trying to find treatment, even as we're still trying to improve things.
Okay, we got to pause there.
Yeah, thank you so much.
Hi, how you doing?
Hey, Taylor, how are you?
Fist bump?
Yeah, absolutely.
People coughing up in here.
Yeah,
Lord,
yeah,
sorry.
I'm one of them. So.
Okay. I have reached a place, I'm not a big fan of psychiatry, no shade, and have been in therapy for a number of years. I've done group, I've done individual, I've done cognitive behavioral therapy.
Okay.
That was my favorite.
Okay.
Hence the, and then I do a lot of grounding exercises. As far as my depression goes, it's changed over time. The one that I suffer from now, unfortunately, is PMDD.
Okay.
Which is the premenstrual depression.
Uh-huh.
And it is horrific in a sense that I'm very confident, I'm funny, I'm cute, my body is tea, I get money, but every 2 weeks, my world is about to get rocked, and there's nothing I can do about it. I just strap in, buckle up, and just wait for the freight train to come, and it is so unfortunate. As far as that goes, it's just like, where are you left with that, And then I'm also in a place where I have been on the front lines politically, and I also benefit from certain privileges in my life. Like, we're not in a war-torn country, and that is kind of where I find joy, which is actually awful to say. Nonetheless, is like, I don't take those smaller things for granted, right?
So she's coming in with a very different description. A lot of other people have kind of this depression hanging over them consistently. And she's saying that basically, I guess, every month, 2 weeks, she is confident, she is going through life with a mission. And then the other 2 weeks, her world is going to get rocked. And I don't think she talked specifically about what kinds of symptoms she experiences, just that it is really heavy around those 2 weeks. And now I am wondering, for something that is that cyclical, would it be better or worse to know that that's happening every 2 weeks? Whereas you take out some of the unpredictability, but also that you're kind of bracing yourself for it. And I also do wonder if you kind of get into a routine where you're expecting it and whether that bracing for it might make things feel worse or better. I'm not quite sure about that. I hope she talks about that more and how she prepares for those weeks that she knows is coming. And it's very interesting what she talked about, that the depression that she's experienced has kind of transformed over time. Now, I talked with Dr. Kirk Honda from Psychology in Seattle, and he kind of talked about this in terms of anxiety for his story, where if he treated one form of anxiety for himself, it would pop up in another area in a different form. And so it seems like she's talking about the same thing, where she's been through CBT. She's not a huge fan of psychiatry, but she's been through different therapies, different treatments, and it seems like the depression has kind of transformed each time, so that as you treat one form, it pops up in another. So kind of that whack-a-mole approach is what Dr. Honda kind of described it as. So I can imagine that would be really frustrating, that as you seem to get one aspect under control, something else pops up that's like, where did that even come from? I had no problems with this before. Sometimes mental health is like that, and it kind of becomes a struggle of what can I live with? What can I deal with on a regular basis? And sometimes maybe you don't even have control over that. And so that's what she's living with right now.
What happens when you can't do anything about it at all? It's just like, what does one do at that point? I heard you talk about Buddhism, and that was really exciting to me because that's what saved me.
Okay.
I was raised Catholic, which is rough. And then when I got sober, I was introduced to spirituality. Would you say that the spiritual realm and the spiritual practice and even a metaphysic practice can be a solution in this sense where there's nothing else working?
Before he answers, I have my own answer to that. And the answer is absolutely yes. I think the research backs that up. And this is what we need to get to when it comes to mental health, is that there needs to be something bigger than me in my life. That connection to something larger can be to God, it can be to family, it can be to a community, something like AA, but just a connection to something larger than myself, so that my suffering is not so all-consuming. It can be put in the perspective of some larger story, some larger purpose, and then it's not as overwhelming to deal with. There's a lot of research that talks about that, but that's when we can get to where my mental health is not so dependent on my own happiness or my life being absent of struggle, because life does involve struggle. And what spirituality, that spiritual component, can add is there's a meaning, there's a purpose to that struggle. There's a reason that I am continuing to work at this and feel like I'm not making any progress, and still feel like it's worth doing, it's worth fighting for. And so what it sounds like is Catholicism did not provide that for her. She said she had a rough experience with it, potentially tied in with some addiction, and spirituality and Buddhism was the way that helped her to find a framework where it was worth fighting, it was worth the struggle. And I want to hear more about what that looked like for her.
Absolutely.
Okay. Yeah.
Would you like to hear more?
Yes.
Okay. So let's start with some data. Something really interesting. You're talking about how, there's a lot of terrible stuff going on in the world today. One of the things that I found really confusing is why all survivors of genocidal conflicts don't have PTSD.
Wow.
It's kind of weird, right? When we think about it, there's like terrible stuff happening, and like the bad stuff is happening to everybody. Like that's the whole point of a genocidal conflict. But actually the majority of people don't end up psychologically traumatized in a way that impairs their function or debilitates them. One of the key things that we discovered when we tried to figure out why everyone who survived a genocidal conflict doesn't have PTSD is something called meaning making. It turns out that our human brain has something called adaptive misbelief. So human brains are designed to believe in all kinds of things that may not be true. Mm-hmm. And the reason is because it's like the height of psychological copium. We have to make sense of the world around us. And this is what's really interesting. I've worked with a lot of people with chronic pain, and I think this is a really hard situation because we can't really figure out what's wrong with you physically. There isn't a diagnosable thing that's going on. It's probably something in the brain, but there's nothing we can intervene on. So if you've got a stomach ache, but there's like nothing wrong with your stomach, then you just have to deal with the ache. So I think this is where making meaning, making sense of your suffering is a huge part to finding relief.
Yeah, so what he's building on is the concept of logotherapy. This was the therapy pioneered by Viktor Frankl, who was a Holocaust survivor, and very similar research. He found that not everyone who was imprisoned in the concentration camps suffered from depression or PTSD, and his claim was that those who could find meaning, who could make meaning out of their suffering, were more resilient, more able to cope. And that's what Dr. K is talking about here. And so this is the tricky part. How do we guide our clients to a place where they can find meaning? A lot of that is going to be in relationship and community. It's hard for me to just assign or ascribe a purpose or a meaning for myself, because a lot of times I'm not going to feel it. That's where sometimes organized religion can prescribe that meaning for our lives, and that works for some people. Sometimes that spiritual journey on an individual level may be able to find some purpose or larger connection. Or sometimes it's in other communities, being able to mentor somebody else or walk with somebody else where we find some of that meaning. But yes, purpose can be a huge protective factor when it comes to trauma or depression.
And if you look at some of these Eastern spiritual perspectives, they'll say that you can't control pain in life, but you do have some degree of control over whether you suffer or not.
Yes.
And this is where there are certain evidence-based, techniques. I practice a lot of stuff that is not evidence-based because I spent years studying in India. But I think that, unfortunately, as a doctor, you're talking about PMDD and how there's nothing you can do about it. You may not be able to fix that. But the way that you handle it, you can handle it in ways that seem to be better, in the sense that you can achieve some degree of peace, or you can handle it in ways that can enhance your suffering. There seems to be a lot of data to support that as well. I happen to think that that's true.
Yeah, I think that's a really good distinction. That's helpful, and I might steal that for some of my clients. We can't control the pain in our lives, but the way that we respond is going to affect how much we suffer from it. I love that distinction. Like I said, I'm probably taking it for some of my clients.
And we got to pause there because we're out of time. Thank you, Taylor.
Thank you.
Thank you
Appreciate
so
it.
much. Oh, yeah, sorry.
Thanks, Blair.
Yeah.
My depression was, it started in 2024 when I was diagnosed with stage 4 Hodgkin's lymphoma, which is blood cancer. And honestly, I can say that in those situations, there's really nothing that could have helped me other than being healthy.
Yeah, thank you for sharing that. I'm curious, what are you thinking? How am I going to respond to that? Do you have an idea?
I feel like there's nothing you can possibly do in that situation because you can't solve the root of the problem.
That's interesting. I appreciate that he's being very open. And this is something that I've noticed with Dr. K is that he's very upfront. I don't know if he's like this with all of his patients, but that's interesting that he was able to say just like, how are you expecting me to respond? Because it didn't seem like much of a question, it just seemed like a description of the circumstances. And yes, I'm sure he can appreciate that she's sharing that. It's also like, okay, yeah, I get that. And what are we talking about here? Because while he is a doctor, I assume he's got the MD. His specialty, of course, is not blood cancers,
which is the cancer.
Yeah, so if we can't, I agree with you. There's tons of research that shows that people who are diagnosed with cancer experience depression. Interesting thing is that's not just a psychological thing, it's also a physiologic thing. Because in stage 4 cancer, your immune system is going whack, there's inflammation in the brain. And I think that this is like, you're right. If you are diagnosed with something that could be a terminal illness, that the most natural reaction is to be depressed. I think that we also have, a subspecialty of psychiatry of trying to help patients with cancer. Sometimes we help people cope with the prospect of death. We help them grieve the life that they could have lived, which they no longer get to because of cancer. I'd like to think that we're able to alleviate their suffering in some way. When you're someone who's been diagnosed with stage 4 cancer at quite a young age, I can't imagine that anything is going to fix that except for exactly what you said.
Well, I didn't know there was a subspecialty, and that must be such a difficult field to be in. For the factors that Dr. K is talking about, first of all, just that it's theoretically logical and natural for somebody to be depressed, especially when they are diagnosed with a terminal disease very early on. And then also for the physiological inflammation that may be contributing to further depression, that you're constantly dealing with frustrating cases, not in the sense that the patients themselves are frustrating, but just that inherently there's so little that you can do, that you're mostly managing psychological and physical pain, I imagine. And you can see that there's a lot of empathy in the room where people are responding very emotionally to some of these stories. And I love that just for the way that it speaks to what peer support can mean. That there are people who feel with you, who can help carry that burden, even if it doesn't change your circumstances at all, that there are people who can grieve with you. There are people who can suffer with you, and we're willing to bear burdens with other people. So I appreciate that they included those clips of other people crying alongside, feeling that pain, feeling that suffering, and feeling for somebody else. There's something really human and really connective in that.
So would you say in those situations, therapy and psychiatry is kind of pointless?
Well, so that I would say no, and I think there are plenty of patients I've worked with who would agree. I think it depends on define pointless.
So my thing with psychiatry is they kind of just help the person cope, but they don't solve the root of the problem. Even not just in like cancer, but in other situations.
Yeah, so I think when psychiatry, in some cases where it's practiced poorly, that's what we do.
I would echo what Dr. K is saying. I think if you want to put it that way, that therapy is all about helping people cope. Yes and no. Yes, in the sense that, yeah, I'm not going to go into somebody's life and fix their problems. I can't do that. That would be unethical. And then that doesn't actually promote their independence. They just come to me as their problem solver. So yes, in that sense, but it's also not as limited as she is making it sound, where being able to cope is a very human response. It's a very human skill. It's something that we must master because we do not have control over all of our circumstances, as you're hearing through all of these different stories. And so being able to cope is a powerful thing. And if my clients can develop that skill through walking through life with me, through working through some research-backed interventions with me, then that becomes a really powerful thing that they're equipped with to go through life, whether it's by seeking and establishing honest, open, supportive relationships, or finding ways to ground themselves or be able to have psychological flexibility. All of these are ways of coping, yes, but they're not a limiting thing. They're an acknowledgement of the reality that no matter what technology we have, we do not have perfect control over our circumstances. And so therefore we must cope. And so I get perspective probably shifts when it comes to a terminal diagnosis. But even then, that's the pain and suffering debate. Yes, you have pain, you have a lot of grief, because there are probably 100 things that you would rather be doing with your life. There are goals that you had, ambitions and dreams that you had that are dying because you do not have the time and the health to achieve those things. And how much suffering is that going to cause for you? Can somebody who's a therapist or psychiatrist walk through that with you and help carry some of the pain that comes from that loss?
So I think psychiatry is a field, I think we made kind of I don't know if this is a mistake. It feels like a mistake to me, that we stopped accepting responsibility for patients' happiness. We started saying that we can teach you coping skills, that's the best that we can do. We can't actually improve your life. We can just improve the way that you cope with your life. I don't think that we do that all the time, but I think it happens way too much. I think psychiatry as a field will throw in the towel very easily. And that too is not necessarily our fault, because I think there's a lot of stuff that we can't control, like we can't cure people's cancer necessarily. But I do think that psychiatry, when it's practiced in the best way, is not about coping. Coping is just what we do to help people put the fires out. Then you get to the real work. I think coping is not the last step, it's the first step.
Ooh, okay. He was about to get on a roll. I'm a little annoyed that he got paused there. So if he's saying that coping is the first step, not the last step, I can get, maybe we have different definitions. So I would include some of the meaning making and finding purpose in your life and finding a positive direction in your life as part of coping, because this is making something out of non-ideal circumstances most of the time. But if we're just saying like coping with like immediate pain and immediate discomfort, okay, maybe that is the first step. So if I were with Dr. K, I would try to define terms there. What are you talking about with coping? And like, what is the next step beyond what you're looking at? What kinds of formative and developmental practices could we be including in the practices of psychiatry for him, therapy for me? And so I think we're aligned, but maybe we just define our terms differently.
Well, thank you.
Thank you. Hello.
Hi, my name's Sterling. I use they, them pronouns.
Okay. Nice to meet you, Sterling.
Nice to
Thank you
meet
for
you
sharing
too.
your pronouns.
Yeah, happily. So something for me is I think therapy is like a good avenue and psychiatry is a good door to open it up, but I feel like there's outside components that need to be done, at least in my personal experience, to like continue like growing positive mental health.
Can you share more about that?
Yeah, like I do think like mental health and physical health is tied. So like sometimes it is internal as well as like outternal, like your mental health versus your body trying to heal like old scars or old traumas, and just finding the balance between like what can really make you happy and bring you the peace and joy that you're like looking for long term.
Yeah, I mean, I completely agree. So I think that, when you say psychiatry is a start, I think there is a portion of things that we can do. And I think what we're discovering is that a lot of your mental functioning, my mental functioning, our brain exists within a body. The nature of the body can profoundly affect the mind. I learned this when I went to India and I started studying yoga. I was in a really bad mental space.
Sure.
And there's a lot of evidence that shows that when we do some of these mind-body practices like yoga or Tai Chi, it rewires our nervous system, which will then affect our mind.
Yeah, it's called neuroplasticity, that our minds can rewire. They can adapt over time. Basically, what we continue to practice is how our minds are going to be wired. And so that's where behavioral activation is important. That's where these mind-body practices like yoga are important. If we continue to live kind of siloed lives where my body's one thing and my mind is another, that contributes to that continued separation, and I've become less aware of the way that my body impacts my mental health and vice versa. And I do agree that psychiatry and counseling should not just be standalone things. Generally, I do want my clients throughout the process of therapy to be changing practices in their own lives, installing habits that are better for them, whether it's eating better, sleeping better, spending time in community more, practicing open and direct communication. All of these things they can take outside of the therapy space, so that's not dependent on me as a practitioner to improve their lives, but they are improving their lives at the same time that we're working through some of the deeper issues that we're working through, and that together creates this effect where they are building purpose and changing their narrative for themselves, changing their stories, so that as they go from therapy, they have a track, a foundation that they've built already to continue in that path.
So I completely agree with you.
Yeah. Having moments or classes where I was able to put myself into my body, realize, oh, I carry shame here. Like physically, I was like embarrassed to dance or to try something new. And it's working the muscles to like be open to like healing and like loving yourself, which is something like I know I've struggled, is just allowing myself to be okay or sit in my emotions.
Yeah, I've had so many clients, a lot of young people actually, who are so uncomfortable in their bodies that just even doing a breathing exercise was anxiety provoking for them to focus on their breathing. And they were judging the whole time, I'm breathing wrong, this isn't right, that's not right, this doesn't feel comfortable. And so more of that integrative practice where I can be okay with like, okay, this feels weird, this feels foreign, but can I sit with that? Can I be okay with that? My body's okay. I'm just not used to engaging with it, paying attention to it. And so many of my clients who struggle with addiction deal with that very problem, where they feel so uncomfortable with their own bodies that drinking or smoking or vaping are ways to escape that awareness, as opposed to turning towards it, turning towards the discomfort.
Yeah, and what has been your experience of working with your body?
Something I found like that I really enjoy is like stage combat. So it's just something that it forces me to think how I would react, how to keep my partner safe, and just being beyond myself.
So there are two I agree with you, but there are two things that I'd love to share. One is, so there are some interesting studies that show that when people are depressed, their physiology is constricted.
Yeah.
So their heart rate stays in a very narrow range. And when we're healthy, our heart rate will kind of go up or down because we get excited and then we get sad, we get tired, we get happy. And so there's literally evidence that shows that if you change your physiologic level of activity, that it'll improve your depression.
Ooh, that's interesting. So that might be one of the mechanisms where exercise is actually really good for people struggling with depression, where you are forcing your body to adapt to these changes in heart rate and other physiological changes that come with the exercise, as well as inducing and ending a stress cycle intentionally that might break out of the funk of things being too flat all the time. That's really interesting.
And there's a really interesting version of this, which is sometimes when I would have patients who were having a panic attack, we tried one thing, which is we would step outside of my office and then we would run as fast as we can for 60 seconds in a park. And something really cool happens when you have a panic attack is, your heart rate is elevating, but if you actually push your body even more and you run really fast, then you feel exhausted at the end of that.
Yeah.
And when you feel physically exhausted, it actually slows down your heart rate, brings your respiratory rate under control, and in some cases can really help with the panic attack.
That's a great tool, and that's one of the ones that's not going to be reimbursed by insurance that I was talking about earlier. In different practices, we talk about ending the stress cycle. So with panic attacks, it opens up the stress cycle. Heartbeat increases, pupils dilate, blood pressure rises, shortness of breath, all of these things that lead to that feeling of panic. And so he's saying, take your body there, let your body go, run, sprint across a field, and then your body has the mechanisms to slow all of that down if you just go with the feeling. So sprint it out, and then your body knows how to shut it all down. You just have to induce that response, and that's a way of accessing it. So that makes a lot of sense. I love that. I don't think I can get my clients to just go and sprint because, first of all, we don't have a field nearby, and there's so many liability concerns with that.
And I completely agree that I think the body is the most underutilized tool in the treatment of depression today.
All right, we're going to pause there. Thank you, Sterling.
Thank you.
We've got
Thank you.
time
Nice
for
to meet
one
you.
more.
I don't know how they are deciding the time limits for certain people, but they left this last person 33 seconds. I don't know what you're planning to accomplish in that amount of time.
Lucia, nice to meet you, Olive.
Nice to meet you.
Thank you for coming today.
Thank you. I did want to mention earlier, she what was your name again? Yeah, Alex. Was talking about how some people do workouts or anything to take their mind off of it, and I feel like I'm the poster child for that, working out and reading and all these other hobbies, but it still doesn't feel enough for me. And same with therapy, and it's different for me because I did group therapy and then I also did DBT, group therapy. I still feel this emptiness and this shadow following me, because also my depression is different because I don't know if anybody else has another mental health that they deal with that kind of coincides with their depression, because for me, I just got diagnosed last year with BPD. So my depression is a whole. I also have a problem with seeking validation, not necessarily from women, but other people. And I sort of kind of immerse myself in other people's to find me in a way.
Yeah, so one thing that she said was very telling was that the way that she approaches exercise, being with people, reading, all of these different things that on the surface are good things, is that she said she uses those to get away from the feelings. This is a huge trap when it comes to mindfulness practices. We treat it as a relaxation exercise. Oh, if you do this, you will feel better. So it becomes an avoidant response. And what we're actually trying to do with exercise, with mindfulness, with any of these different practices, is actually engaging with the feeling. It gives us a vehicle to be able to connect with the feeling in our bodies. And when we treat it as a way to get away, it actually causes that depression to persist. So yeah, she's also saying that on top of things, she has some difficulty with a sense of identity outside of other people. So she finds a lot of that validation, a lot of that sense of herself in other people, which would lead to a lot of compromised boundaries. It could lead to a lot of dependence when it comes to I'm only okay if the people around me are okay. So taking on other people's emotions. Let's see what Dr. K has to say about that.
Lucia, thank you so much for sharing that, because I'm glad that you shared the sense of emptiness that comes with BPD. So I think sometimes when we talk about depression, we talk about it like one thing. Depression is a way that you feel, and there are lots of different contributions to that. So I personally have learned so much from my patients with BPD. It's been some of the most rewarding and difficult clinical work I've ever had to do. So I'd like to just talk about BPD for a second, if that's okay.
Yeah.
For people who don't know, there's a certain kind of depression where, see, we go through the world and I have a sense of who I am. Mm-hmm. And I carry that with me wherever I go, right? So if someone calls me an idiot, I have some sense that I'm not an idiot. When someone has BPD, that can be absent or very, very quiet. Mm-hmm. And so the way that they feel is literally determined like a vacuum. It's a void that gets filled up by the way that people treat them. So if someone treats you really well, you feel great. And if someone treats you really poorly, you internalize that. And so a couple of things about BPD is that it's actually one of the things that improves really well. So I think like at 16 years out from diagnosis, 95+% of people actually won't qualify for the diagnosis anymore. So it is something that can get healed. But I think that it's really, really hard before it happens. And I think that a lot of the work that I do around BPD is about really getting in touch with who you are.
BPD is difficult because the prevailing pattern is to internalize a lot of the feedback that you're getting, a lot of the signals that you're getting from people around you. So like Dr. K talked about, somebody's happy with you, great. But if it feels like somebody is mad at you, it really quickly extends to, oh, they're going to leave me, they hate me, and things get really intense from there. It can be very reactive. I did not know that it could be so successfully treated, but that's really good to hear. And of course, she said that she engaged with DBT in the past, and that is one of the primary treatments when it comes to personality disorders.
It feels empty. It feels like a void. And then the reason that people get diagnosed with this is because they're missing. Oftentimes there's trauma early in life. So
I wanted to touch on that, is that like I am like also religious. I'm Jewish. I converted after I graduated in 2024 from high school. Like once again, like I've done all of these things, and I think also what makes it hard for me with my BPD is also like the amount of trauma that I've been through, because I also went through a loss. Like I lost my father from COVID 6 years ago. He was never in my life, like never knew him.
Trauma has a huge effect when it comes to BPD, particularly because of the way that trauma can hardwire some of these beliefs into our mind. So when it comes to things like my sense of worth, if the trauma has a direct impact on my own sense of identity, on the way that I think about myself, then I can become very open, very susceptible to just whatever I think other people believe about me, because I don't trust my own sense of identity anymore. I don't trust my own sense of myself, and therefore I get it from all the people around me.
I also do seek my validation from relationships, because I've never had that father figure before.
Of course.
And it's like the abandonment and of everything. And that's why also like I sought conversion also to like help me move through it. But like yet again, like it still feels like there isn't that like light for me because of how much like other trauma that I've experienced too.
And I think that that's what's really hard. So the thing is, since there's that kind of void inside, I don't know if this makes sense. The hopelessness can fill up that void, and then you will feel full of hopelessness. You know, and that's what I've seen with people with BPD, is that when you're feeling down, it fills up every cell of your body, and then it's so big. Mm-hmm. The good news, there is a way to find that stability within yourself, to find a sense of self that kind of like is a life raft. And once it's kind of there, then people can really start to stabilize around it. And like I said, the outcomes from BPD are actually quite good.
Yeah, so what Dr. K is talking about is self as concept. This is an idea within ACT. I know I'm drawing a lot from ACT, but he seems to be as well. That emotions and feelings are happening within me. I am the context, I am the backdrop, I am the setting of those feelings, not that these feelings have consumed me, but they are within me. And so that's a reframe that can be helpful, just to have a sense of like, this is not bigger than me. It is within me, and it feels huge right now, but I can manage that relationship with it.
Just because it is one of the most painful things, that has nothing to do with how long it will last. That has nothing to do with its permanence.
So that is it for that section. That covered a lot of ground. One thing that I noticed a lot was Dr. K has a really good gift for validating without it coming off as condescending or just blindly agreeing with somebody. He's always able to say, hey, I see the struggle that you're having. I see the difficulty and the pain that you're experiencing. Can I add some context to that? Let me add a little bit of the research that I know. Have you considered X, Y, or Z? And so that's something that I really appreciate about being able to see him do this in the work and the conversations that he's having, where he is meeting each person on the ground that they're on with the story that they bring in and saying, okay, I hear that, I get that, let me add these one or two things. And that does take some skill, because it could be very easy to devolve into arguing with some of these opinions, not in the sense that he's frustrated or angry with them, but just because of his knowledge, it would be easy to say like, okay, that's not right. And to be able to challenge and add knowledge without it coming across as confrontational or condescending does take skill. So I appreciate that. These are very emotional stories, and you can see that other people were responding to that. I think the big takeaway from these stories is that mind and body are connected. Both are part of you. And so we have to take care of our bodies that will nurture our minds, and vice versa. And so depression is not just a mental illness, it's a whole body illness. There are physiological responses to depression, and there are physiological things that we can do that can improve the condition in our lives. A lot of that also comes down to our relationship with the feelings that we have, the feeling of being hopeless, the feeling of struggling with no end in sight. And a lot of that comes down to the sense of purpose and connection with something larger that we might try to foster through community or through spirituality or through religion. So there's a lot of different practices that are not necessarily going to be reimbursable by insurance, but are still highly effective and really important for that long-lasting change, more so even than medication or talk therapy. So thank you all so much for watching this video. Thank you for going on this series with me. Really appreciate your encouragement along the way. This was so worthwhile to be able to watch. So thank you all so much for watching, and I'll see you all next time.